Increasing pain in chronic wounds is not normal. Here's why. If a chronic wound starts becoming more painful over time, that is not a normal part of healing. And this is one of the most commonly missed red flags in wound care. I am Patty, a nurse practitioner specializing in wound care, and today I want to talk about something that gets brushed off far too often: increasing pain in chronic wounds. Because unlike acute wounds, chronic wounds don't always show classic signs of infection. Pain is often the first, and sometimes the only, clue that something is wrong. The misconception. A lot of clinicians assume that pain is expected. The wound looks open, it looks inflamed, so pain feels logical. But here's the key point. Pain should gradually decrease as a wound heals. When pain is increasing, especially after weeks of treatment, that tells us the wound is no longer following a normal healing trajectory. Why pain increases in chronic wounds? In chronic wounds, increasing pain is most often associated with three things. First, persistent inflammation. Chronic wounds often get stuck in the inflammatory phase. Inflammatory mediators continue to fire, nerve endings remain sensitized, and pain escalates instead of resolving. Second, biofilm or occult infection. These don't always produce pus, redness, or systemic signs. But they do disrupt tissue and increase pain, often before you see visible deterioration. And third, ischemia or pressure-related injury. Poor perfusion, unrelieved pressure, or edema can cause tissue hypoxia, which is painful and delays healing. What pain is not? This is important. Increasing pain is not a normal sign of granulation. It's not expected just because a wound is chronic. And it's not something to ignore if everything else looks okay. In chronic wounds, pain is a data point, not a symptom to dismiss. How I use pain clinically. When I assess a wound, pain trends matter just as much as size or drainage. If pain is new, worsening, or out of proportion, I immediately start asking, is this wound stuck in inflammation? Is there unrecognized biofilm? Is debridement adequate? Is pressure, moisture, or perfusion being missed? Pain helps me decide when it's time to change strategy, not just change dressings. Expert differentiator. This is where experienced wound clinicians think differently. We don't wait for dramatic visual changes. We listen to subtle signals, and pain is one of the loudest ones. A chronic wound that becomes more painful is communicating. If we ignore that message, healing stalls. Final. I have organized this entire clinical thought process, including how to differentiate infection from inflammation and what to do next, into my advanced wound care guide for clinicians. If you want to stop guessing and start interpreting what wounds are telling you, that guide is linked below. And if this video helped you, make sure to subscribe. I share practical wound care insights like this every week.